Some warning signs and risk factors to look out for in your kid and teenager if you're concerned about suicide. First of all, talking about suicide does not increase the risk of your teenager dying by suicide or engaging in self-harm. It actually opens up the door for more conversations and open discussions and has been shown to be a very protective factor. So immediate risk that will likely intensify about 24 hours before the attempt, and parents and teenagers can all reliably identify this usually, is social withdrawal and isolation, increased communication about suicidal ideation and or non-suicidal self-injury or any sort of self-harm, expression of self-hate or emotional pain, as well as feeling like a burden. So feeling like a burden is a really big predictor. So keep an eye out for that one in particular. Any big conflicts can be a trigger. So kind of keep an eye out for that specifically, but also just for prolonged mood concerns and changes in behavior as well. And here are some main risk factors we want to monitor for. So number one, access to lethal means. Ensure there is safe gun storage in your home. Same with even like knives, razors, medication. Ensure that all of that is not accessible to your child. History of psychiatric disorders, of course, depression, bipolar is probably what comes up for a lot of people, but substance use and trauma history are also incredibly important risk factors, as well as any sort of like exposure to violence or victimization, and family history of suicide completion in particular is a big risk factor.